As men enter their 62nd and beyond, many are unprepared for a surprising truth. The penis ages faster than nearly any other part of the body. Blood flow diminishes, sensitivity wanes, and subtle changes often go unnoticed. Yet these shifts can serve as critical early indicators of serious health conditions, such as cardiovascular disease, diabetes, or even early-stage cancer. Despite its profound importance, this topic is rarely discussed openly, leaving many men to navigate these changes in silence. I'm Dr. James Carter, a board-certified urologist and men's health specialist with over 30 years of experience helping men across the country age with strength, clarity, and confidence. Having worked with thousands of patients, from retirees to executives, I can tell you unequivocally, caring for your penis is not just about maintaining sexual function, it's about safeguarding your dignity, extending your longevity, and reclaiming the vitality that keeps you fully engaged with life. What many men don't realize is that silent damage may already be occurring, even if everything appears normal on the surface. The penis is a sensitive barometer of your overall health, and neglecting it can have far-reaching consequences. The good news? It's never too late to take control. In this comprehensive guide, I'll share 5 essential strategies to care for your penis after 60 practical, evidence-based steps that not only enhance sexual health, but also bolster your heart, brain, and emotional well-being. At the end, I'll reveal the one habit most men overlook, which could be the most critical for preserving your health and quality of life. Before we begin, I invite you to subscribe and turn on notifications to receive tailored health advice designed for men like you. If this message resonates, type 1 in the comments below. If it doesn't, type 0 and share how I can better support your journey. Let's dive into the first and most foundational step, because without it, every other aspect of your health could begin to falter. 1. Prioritize healthy circulation. Healthy blood flow is the cornerstone of penile health and a vital component of overall vitality. I recall a patient, John, a 65-year-old retired high school teacher and avid gardener, who came to my office feeling disheartened. "Dr. Carter," he said, sitting across from me with a heavy sigh, "I don't feel like the man I used to be." He wasn't referring to his identity, but to a subtle, unsettling loss of responsiveness in his penis. No sharp pain, no obvious symptoms, just a gradual fading of sensation, fullness, and confidence that left him feeling disconnected from his body and his partner. What John didn't know is that the penis is a window into your cardiovascular system. Its blood vessels are among the smallest in the body, making them highly sensitive to circulatory changes. When these vessels narrow due to plaque buildup or inflammation, the penis is often the first to signal trouble, sometimes years before a heart attack, stroke, or other major event. Research published in the Journal of Sexual Medicine indicates that erectile dysfunction can precede cardiovascular events by 3 to 5 years, positioning the penis as a critical early warning system for your heart and brain. When blood flow to the penis declines, the consequences extend beyond sexual function. The smooth muscle fibers and elastic tissues within the penis rely on consistent oxygenation to remain healthy. Without it, these tissues can atrophy, leading to weaker erections, reduced sensitivity, and long-term structural changes that make intimacy challenging or even unattainable. Over time, this can erode confidence, strain relationships, and diminish quality of life. The empowering news is that you can significantly improve circulation with simple, intentional lifestyle changes that yield benefits far beyond the bedroom. Start with 30 to 45 minutes of brisk walking daily, whether it's a morning stroll through your neighborhood, a hike in a local park, or time on a treadmill while listening to your favorite podcast. Aerobic exercise strengthens your heart and enhances blood flow throughout your body, including to the penis. Incorporate strength training 2 to 3 times a week, using weights, resistance bands, or bodyweight exercises like squats and push-ups to boost vascular health and support testosterone production. Managing blood pressure through stress reduction techniques such as mindfulness or yoga and quitting smoking are non-negotiable. Smoking constricts blood vessels, directly impairing penile function, while high blood pressure damages vessel walls over time. Diet is another powerful tool. Foods rich in nitric oxide, such as spinach, arugula, beets, pomegranates, and watermelon, naturally dilate blood vessels, improving flow to the penis and other organs. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, or sardines, as well as walnuts and flax seeds, reduce inflammation and keep blood vessels supple. Limit processed foods, refined sugars, and trans fats, which contribute to arterial plaque and poor circulation. I also recommend staying hydrated. Aim for at least 8 glasses of water daily to support vascular function and overall energy. 6 months after adopting these changes, John returned to my office, transformed. His erections were stronger, but more importantly, he radiated a renewed sense of purpose. "I feel connected again," he told me, his eyes bright with emotion. "Not just to my body, but to my wife, my hobbies, my life. I didn't realize how much I'd been missing." Improved circulation didn't just restore his sexual health, it revitalized his heart, mind, and relationships. Healthy blood flow isn't just about performance, it's about reclaiming the energy and confidence to live fully. But circulation is only one piece of the puzzle. There's another critical area where many men fall short, and neglecting it can lead to serious consequences. If you're finding this valuable, comment 1 below, and let's move to the next step. 2. Maintain impeccable hygiene. Proper hygiene is a non-negotiable foundation of penile health, yet it's a topic many men avoid discussing until a problem becomes unavoidable. I once treated Mark, a 70-year-old widower and former auto mechanic who loved tinkering with classic cars in his garage. Mark came to me with persistent irritation, redness, and an odor he couldn't explain. He was reluctant to share his symptoms, having delayed seeking help for nearly a year out of embarrassment. After a thorough examination, we discovered a fungal infection under his foreskin, a completely preventable condition caused by inadequate hygiene. Mark's story is far from unique. As men age, especially those living alone, widowed, or facing mobility challenges, personal care can gradually slip. Tasks like bending over or reaching become harder, eyesight may weaken, and daily routines erode, leaving the penis a highly sensitive and vulnerable area neglected. Poor hygiene does more than cause discomfort. In uncircumcised men, moisture trapped beneath the foreskin creates a warm, damp environment, ideal for bacteria and yeast, increasing the risk of painful infections like balanitis, chronic inflammation, or, in rare cases, penile cancer. Even circumcised men can develop issues if sweat, dead skin, or debris accumulate in skin folds. Over time, these problems can erode physical comfort, undermine confidence, and strain intimate relationships. For men with chronic conditions like diabetes, which impairs immune function and healing, poor hygiene can lead to recurrent infections that are harder to treat. The solution is straightforward, affordable, and transformative. Wash the penis daily with warm water, gently retracting the foreskin, if uncircumcised, to clean underneath. Use a mild, fragrance-free soap or a gentle cleanser designed for sensitive skin to avoid irritation. Rinse thoroughly to remove sweat, smegma, or debris, then pat dry with a clean towel to prevent moisture buildup. Avoid harsh soaps, body washes with strong fragrances, or aggressive scrubbing, which can strip natural oils and cause micro-tears that invite infection. For men with limited mobility or arthritis, a handheld showerhead, a long-handled sponge, or assistance from a trusted caregiver can make this process easier. If dexterity is an issue, consider sitting on a shower chair for safety and comfort. Mark, after adopting these habits, returned to my office a month later with a renewed sense of control. The infection cleared, and his discomfort vanished. His new partner noticed the difference too, not just in cleanliness, but in Mark's confidence and openness to physical and emotional intimacy. "I feel like I'm taking care of myself again," he said, "and it's changed how I show up in my relationship." Hygiene isn't just about avoiding problems. It's an act of self-respect that sends a powerful message: my body matters, and I'm worthy of care. Proper hygiene fosters confidence, strengthens relationships, and lays the groundwork for the next critical step in penile care. Let's explore that now. 3. Stay sexually engaged. Sexual activity, whether with a partner or solo, is a powerful and often underestimated tool for maintaining penile health and overall well-being. I once met David, a 8-year-old retired firefighter and proud grandfather, who visited my office complaining of low energy, irritability, and a general sense of disconnection. During our conversation, he quietly admitted he hadn't engaged in any sexual activity, not even self-stimulation, for over 3 years. "It didn't seem important anymore," he said, his voice tinged with resignation. But his eyes told a different story. He felt he'd lost a vital part of himself, a spark that once defined his sense of masculinity and vitality. What I shared with David is a message I want every man over 60 to hear. Staying sexually active isn't about performance, proving your prowess, or chasing youth. It's about preservation and connection. The penis is composed of living tissue that thrives on regular blood flow, oxygenation, and nerve stimulation. Sexual activity, whether through intercourse, mutual touch, or solo stimulation, keeps these tissues healthy by delivering oxygen-rich blood, maintaining elasticity, and preserving nerve sensitivity. It also supports hormonal balance by encouraging testosterone production and triggers the release of dopamine and oxytocin, neurotransmitters that enhance mood, reduce stress, and foster emotional resilience. Without regular activity, penile tissues can stiffen, lose flexibility, and become less responsive, leading to weaker erections, reduced sensation, and a sense of disconnection from your body. These physical changes often spill over into emotional health, eroding confidence, straining relationships, and diminishing quality of life. For men facing erectile challenges, chronic illnesses, or a lack of a partner, redefining intimacy is key. Sexual engagement doesn't have to mean intercourse. Gentle touch, mutual arousal, or solo exploration are equally valuable. Experiment with lubricants to enhance comfort, or try mindfulness techniques to focus on sensation rather than performance. For couples, open communication about desires and limitations can transform intimacy into a shared journey of connection rather than a goal-oriented task. Solo stimulation, often stigmatized, is a healthy and natural way to maintain penile function and emotional well-being. If libido is low, consult a healthcare provider to rule out underlying issues like depression or medication side effects. David, after reintroducing regular stimulation into his life, returned 3 months later with a newfound vibrancy. "I feel like I've rediscovered myself," he said, his voice full of warmth. "I walk taller, laugh more, and feel closer to my wife than I have in years." His blood pressure improved, his mood stabilized, and he reconnected with hobbies like woodworking that he'd abandoned. Sexual engagement isn't vanity, it's vitality, a way to stay anchored in your body, your relationships, and your sense of self. But there's another hidden factor influencing your energy, drive, and penile health, a factor many men don't notice until it's significantly diminished. Let's dive into that next. 4. Monitor your hormones wisely. Testosterone is the silent engine powering male vitality, and its gradual decline can profoundly affect penile health, energy, mood, and overall quality of life. I once treated Robert, a 72-year-old accountant and avid chess player, who came to me feeling off despite a seemingly healthy lifestyle. He woke up exhausted, lacked motivation, and had lost interest in sex, a stark contrast to the vibrant man he once was. "I thought this was just what aging feels like," he told me, shrugging. Blood tests revealed a different story. His testosterone levels were significantly low, a common but often overlooked issue in men over 60. Testosterone isn't just about libido or building muscle. It's a foundation for mental clarity, emotional resilience, bone health, and the health of penile tissues. When levels drop too low, erections become harder to sustain, sexual desire wanes, and the penis becomes less responsive, contributing to a sense of disconnection from one's masculinity and vitality. Low testosterone also affects broader health. Men with suboptimal levels are at higher risk for fatigue, depression, weight gain, and cardiovascular issues. The penis, with its hormone-sensitive tissues, is particularly vulnerable to these changes, as testosterone supports blood vessel health and nerve function. Restoring testosterone, however, requires a thoughtful and individualized approach. A comprehensive hormonal evaluation is essential, including measurements of free and total testosterone, estrogen, thyroid function, and prostate-specific antigen (PSA) levels to rule out prostate concerns. A single blood test isn't enough. Hormones fluctuate, and context matters. I also assess lifestyle factors, as testosterone is highly sensitive to diet, exercise, sleep, and stress. Lifestyle changes can significantly boost testosterone naturally. Resistance training, such as lifting weights, doing bodyweight exercises, or using resistance bands, stimulates testosterone production and improves muscle mass. Aim for 2 to 3 sessions per week, focusing on compound movements like squats, deadlifts, or bench presses. A diet rich in healthy fats, avocados, olive oil, nuts, zinc oysters, beef, pumpkin seeds, and vitamin D, egg yolks, fortified foods, or sunlight exposure supports hormonal health. Cutting refined sugars and processed carbohydrates prevents insulin spikes that suppress testosterone. Prioritize 7 to 9 hours of quality sleep nightly, as testosterone is primarily produced during deep sleep cycles. Stress management through meditation, journaling, or hobbies reduces cortisol, a hormone that inhibits testosterone. For some men, like Robert, lifestyle changes alone aren't enough. After a thorough evaluation, we initiated a carefully monitored, low-dose testosterone replacement therapy tailored to his needs and regularly adjusted based on follow-up tests. Within 4 months, Robert was transformed. He was sexually active again, re-engaged with his chess club, and planning a cross-country trip with his wife. "I didn't realize how far I drifted from myself until I came back," he said, his smile reflecting a renewed zest for life. Monitoring testosterone isn't about chasing youth or quick fixes. It's about restoring your energy, confidence, and connection to the life you want to lead. But there's one final practice most men avoid, and it could be the key to catching problems early and preserving your health for years to come. 5. Perform regular exams. Regular penile exams are a critical yet often overlooked component of men's health, as vital as monitoring your heart, cholesterol, or prostate. I've had patients resilient, accomplished men like veterans, business owners, and grandfathers sit across from me and say, "Dr. Carter, no one's examined down there since I was a kid." Each time I hear this, my heart sinks, knowing how many silent issues, from treatable infections to early-stage cancers, can go undetected without routine attention. Take George, a 71-year-old retired engineer and marathon runner who came to my office for a routine checkup, feeling healthy and active. During a brief genital exam, I noticed a small, painless lesion on his penis that he hadn't seen himself. A biopsy revealed early-stage squamous cell carcinoma, a type of skin cancer. Because we caught it early, it was removed with minor surgery, requiring no further treatment. That exam likely saved his life and preserved his sexual function. Self-exams are the first line of defense and take just a minute each month. In the shower or after drying off, inspect your penis carefully, using a handheld mirror if needed to check hard to see areas. Look for lumps, bumps, sores, discoloration, skin thickening, or unusual bends or curvatures. For uncircumcised men, gently retract the foreskin to examine underneath for redness, white patches, or buildup. These checks aren't about vanity, they're about responsibility. Knowing your body's baseline allows you to detect changes early when they're most treatable. If you notice anything unusual, don't delay, consult a healthcare provider promptly. Embarrassment or hesitation can turn minor issues into major ones. The second step is advocating for professional exams. Many general practitioners skip genital exams during annual physicals unless prompted, but a trained eye can spot early signs of conditions like Peyronie's disease, abnormal penile curvature, lichen sclerosis, a chronic skin condition, infections, or vascular changes that signal broader health issues. Ask your doctor explicitly for a genital exam, just as you would request a prostate check or blood work. If your provider seems dismissive, seek a urologist who specializes in men's health. George, reflecting on his experience, told me, "That exam gave me peace of mind and years I might have lost. I'm running marathons again, and I feel unstoppable." Regular exams empower you to take charge of your health, ensuring you age with confidence, control, and resilience. Final thoughts: reclaim your vitality as a man. After 35 years as a urologist, I've come to a profound realization: the most neglected part of a man's body isn't just his penis, it's his permission to care about it. Society teaches men to be stoic, to ignore changes, to dismiss discomfort as just aging. But your penis is an integral part of your body, as deserving of attention as your heart, brain, or lungs. It's not just a functional organ, it's a symbol of your vitality, your connection to intimacy, and your right to feel fully alive. By prioritizing circulation, you keep your body vibrant from head to toe. Through Impeccable Hygiene, you restore confidence and foster closeness with yourself and others. By staying sexually engaged, you preserve physical function and emotional resilience. By monitoring hormones wisely, you rekindle your drive and sense of purpose. And through regular exams, you ensure early detection of issues, protecting your health and longevity. I've had the privilege of guiding thousands of men through these changes. Men like John, Mark, David, Robert, and George, who face their challenges with courage and honesty. Those who treat their penis as a vital part of their whole health, not a separate, shameful thing, are the ones who age with unparalleled strength, grace, and dignity. They don't shrink into the background. They show up fully for themselves, their partners, and their lives. This journey isn't about preserving function alone. It's about reclaiming a part of yourself that still has life, power, and purpose. Your story isn't over. Your body matters. If this resonates with you, comment 1 below and take the first step today, whether it's a brisk walk, a hygiene routine, a moment of intimacy, a hormone check, or a doctor's visit. Choose to show up for yourself, not out of obligation, but because you deserve to feel vibrant, connected, and whole. Aging is inevitable, but surrendering your vitality is not. Let's walk this path together, and let's keep you thriving for years to come.